Routine HIV testing at GP surgeries in high-risk areas of the UK could save money and lives, according to scientists at the University of London. They examined data from the London Borough of Hackney and found that introducing an opt-out test when people join a new GP surgery quadrupled the rate of diagnosis. Lorna Shaddick reports.
Hello. Hey.
Alex is enjoying a normal afternoon, meeting up with a friend at a local park. But just 3 years ago, he was seriously ill in hospital, diagnosed with HIV so late that his life was at risk.
The doctor came in and said, sorry, I'm going to have to rush you to A&E right now. Your platelet count is so low that it's dangerous and we need to admit you to hospital.
Alex only found out what was wrong with him after months of feeling unwell, when he eventually went to a clinic, referred by a GP surgery that couldn't offer an HIV test itself.
Had I had that HIV test done at the GP surgery, I would have caught it a lot earlier. And, you know, I could have not got myself into the very dangerous situation that I did.
It's cases like Alex's that led researchers to seek this new data. They say it shows that offering routine opt-out HIV tests for patients when they visit a GP is money well spent.
What's very important about this study particularly is that it's showing us for the first time that it is not only important in terms of health, but it is cost effective. So it makes financial sense to invest in testing to prevent the extra cost to the NHS further down the line.
The tests used in the study, done across 40 surgeries in Hackney, looked just like the one I'm having now. A quick finger prick and you get the results straight away. 1 dot for negative, 2 for positive. The researchers behind this study want HIV testing to be rolled out as standard in GP surgeries in all local authorities where there's a high prevalence of the virus. That is, where there's more than 2 diagnosed infections per 1,000 adults. And that would certainly apply right here in Lambeth, where the level is 14 per 1,000, the highest in the country. The researchers now want screening rolled out at GP surgeries in the 74 local authorities in England that have the highest rates of HIV, at a cost of £4 million. But the head of the Royal College of GPs says her colleagues, who get just 10 minutes a patient, can't take on the extra work. Normalising testing for HIV to reduce stigma is a good step forward, she says, and we urge patients who believe they may be at risk to be tested. However, random and routine testing of all patients is not the answer. It's difficult to see how hard-pressed GPs and their teams could actually do this on current resources, as we have a severe workforce shortage. Alex's HIV is now under control, but doctors will want more money and support, as well as statistics, if cases like his are to be avoided in future. Lorna Shaddick, Sky News.